Parents infuriated after officials at a South Florida school district make up their own guidelines that students do not need a mental health advocate or doctor approval to alter their gender. Well, joining us now to discuss the latest crisis in the classroom, Aimee Viana, a distinguished education fellow for parents defending education. Aimee, good morning to you.
Good morning.
First, let's read together what the actual guidelines state from Miami-Dade County Public Schools. This is what they state. The student is undergoing an incredibly personal experience. Few youth want to be the center of attention, particularly for such a personal matter. Only the student can determine their gender identity. Outside confirmation from medical or mental health professionals or documentation of legal changes is not required. So, Aimee, talk us through this. What led to the school district implementing this policy in the first place?
Sure. Well, first, thank you for having me. As a mother of 3 children myself and a former teacher and school principal, I understand how difficult it can be to discuss the topic and all of the surrounding impacts that you just mentioned. So I think that that's where the conversation should always begin, with an acknowledgement that this issue is complex and there are so many opinions and considerations that need to be taken into consideration when drafting policies like the one that you just shared today. The underlying intentions, as stated in the guidance, are that students should learn in a safe and non-discriminatory environment. And of course, no one is arguing that. But it is essential to remain mindful that although these guidelines are meant to provide a positive and proactive approach, there are a wide range of factors and guiding principles that need to be considered. And decision-making in a school system at any level should really begin and end with the same focus in mind, which is supporting the whole needs of the student. And how can we support students if we don't engage their primary support, which is their family? So really, any effort by school officials to draft and implement policies should be driven by a comprehensive approach, because we run into lasting problems when school officials react quickly and without properly engaging parents and other important professionals.
And it's such a critical decision for a child to make. From your perspective, how involved should medical professionals be in a decision like this? Why is this decision allowed to be determined in a school environment?
Jan, you're absolutely right. This is a critical decision for anyone, especially a young person, to make. And that is all the more reason that these discussions should be transparent and involved. As I said, when making such impactful policies, officials should remain student-centered and utilize all available resources. That should include medical and health professionals, but most importantly, parents. And this is precisely why school boards and the decisions that they make matter. As parents and community members, we all have a duty to elect people to these school boards that will represent the values and support the decision-making process that is best for our children.
When it comes to privacy and confidentiality, I want to read what the policy also states. Transgender and gender expansive students have the right to decide when, with whom, and to what extent to share private information. When contacting the parent guardian of a transgender or gender expansive student, school staff should use the student's legal name and the pronoun corresponding to the student's assigned sex at birth, unless the student or parent guardian has specified otherwise. So some say this obviously implies that school staff should lie, because school staff and teachers would essentially be concealing if a child wants to change their gender. We have reached out to the school district for clarification. We haven't heard back. But what do you make of teachers being told to use pronouns assigned at birth when speaking with parents or guardians? And if there is this concern of abuse at home, or that there needs to be concealment for a reason, isn't that a greater issue that the school district needs to address? Aren't they required to report that?
Absolutely. School officials are required to report when there is any type of situation in which they think that the child may be in danger or harmed. So these questions that you're posing, Jan, are absolutely great questions. They're questions we should be asking the individuals who are putting these policies in place. And some other real questions that I have are, if the decision-making process is really grounded in meeting the needs of students and providing them with safe environments that are protective and support them, then why wouldn't we want to collaborate and work together as a child is working through this type of critical situation? And while there may be viable considerations for not disclosing this information to parents, I'd be interested in understanding how that conclusion came to be. Were parents, medical professionals, mental health professionals consulted when drafting this guidance? Who was involved? And how was this decision to exclude family and other professionals that are closest to the students determined?
I know a lot of parents contact your organization if they want to share what's happening inside their school because they fear of any kind of retaliation that could happen to their child. So where can they contact you if they have a story or they have an issue that they want you guys to look into?
Parents Defending Education works hard at three things: empowering parents, exposing inadequacies, and engaging communities. And if parents would like to share what's happening in their child's school or in their district, they should go to defendinged.org. There they can learn how to advocate for classrooms that educate their students.
And that's where you guys also get a lot of whistleblowers. All right, Aimee, great talking to you this morning. Thanks so much for joining us. We appreciate it.
Thanks for having me.